Hi, hello guys, welcome back to my channel. This is Dr. Najib and I am here with the general and local anesthesia pharmacology. If you are visiting my channel for the first time, then don't forget to subscribe and like the video. So without wasting much time, let's begin. First thing is first, so what is anesthesia? Anesthesia is the reversible condition induced by anesthetic drug that causes the reduction or complete loss of pain or other condition consciousness and muscle movements during surgery or other invasive procedure that can be painful. Okay, there are two types of anesthesia: general anesthesia and local anesthesia. Now, what is this general anesthesia? Which makes the whole body lose feeling, movement and consciousness. Okay, drugs that are used to induce this type of anesthesia are called as general anesthesia. And second type is local anesthesia, which numbs only a specific targeted area of the body. And the drugs that are used to induce the local anesthesia are called as local anesthetics. And now anesthesia performed with a general anesthetic occurs in 4 stages. So those are induction, excitement, surgical and medullary paralysis. And let's go with induction. First stage is known as induction. It is simply a period during which the patient goes a stage from consciousness to the state of unconsciousness. And next we have the second stage known as excitement. At this stage, depression of inhibitory neurons in the CNS leads to increased excitement, involuntary muscle movements, increased heart rates, blood pressure and respiration. And the next we progress to the third stage known as surgical anesthesia. At this stage there is a gradual loss of muscle tone and reflexes. Patient is fully unconsciousness, unresponsive to surgery and has a regular breathing, and this is the ideal stage for surgery and careful monitoring is necessary. And the last stage, that is the fourth stage known as the medullary paralysis or overdose. At this stage, respiratory and cardiovascular failure occurs, which leads to the death of the patient, cannot be reviewed quickly. So now let's move on to the discussion how generally anesthesia works. So at the macroscopic level, the action of general anesthesia on thalamus and reticular activating system leads to the reversible loss of consciousness. The action on the hippocampus, amygdala and prefrontal cortex causes amnesia. And finally, the action on the spinal cord is responsible and for the immobility and analgesia. So the drug is the dexmedetomidine, which produces sedation and analgesia without the risk of respiratory depression. So now look at the brief discussion of the pharmacology of the local anesthesia. Unlike general anesthesia, local anesthesia produces transient loss of sensory perception, especially of a pain in a localized area of the body, without producing unconsciousness. Example of the most widely local anesthesia are the lidocaine, procaine and tetracaine. When used properly, local anesthesia are generally very safe and serious reactions are very rare. However, when systemic toxicity occurs, patient may experience symptoms ranging from blurred vision to the lightheadedness. If you feel this channel is informative, then click the like button and don't forget to subscribe. I hope you enjoyed this video and as always, stay tuned for more videos.